Well, so glad to have all of you with us today. We're really glad that we can come together again through this platform in this time of social distancing. We're bringing you a workshop from Cancer Support Community called Frankly Speaking About Cancer, Making Treatment Decisions. We're going to cover a lot of information in this presentation. And so we encourage you to go back and take notes on the information that applies to your needs. You can begin to maybe create or improve your personal treatment decisions that align with your needs, values, and goals. It will take some time and thought and will be well worth the effort in making this treatment plan your plan. There's an evaluation that we ask you to fill out after watching this presentation that's linked below. Gilda's Club Grand Rapids receives a grant to present this information to you, and our funding is dependent on having evaluations completed. We would greatly appreciate your important feedback on the value of this information and your help in fulfilling our requirements. All right, so let's get started. So an overview of this workshop, we'll have introductions, go over treatment planning basics, choosing your treatment team, setting goals, guidelines and pathways, treatment options, caregiving, and then we'll have some question and answers. The following slides were updated and medically reviewed by Thomas LeBlanc, MD, in April 2020. A disclosure, this program was developed by Cancer Support Community, of whom Gilda's Club is an affiliate. We developed the content independently and then had outside medical and psychosocial experts review it. Cancer Support Community has final control over the content of our programs. This program was generously sponsored by Pfizer Oncology. The presenters were engaged by your local Gilda's Club Grand Rapids. So today, the following presenters are from your own Gilda's Club Grand Rapids. Myself, Sandy Ossie, Doris Van Meurs, and Lindsay Jousma. So we, Sandy Ossie, Doris Van Meurs, and Lindsay Jousma, have no financial relationships or affiliations to disclose and are not being paid by Pfizer Oncology. The objectives of this presentation are to learn how to recognize your treatment needs and how to respond, to be knowledgeable about your diagnosis and treatment options, to learn how to build your support system, to ask questions and advocate for what you need, information for caregivers and making treatment decisions, and making the choices that are right for you. Here's some tips for those newly diagnosed. So you or a person in your life may have been diagnosed with cancer, but that doesn't mean that cancer defines you. You can educate yourself, get support, and have hope and courage. Some treatment planning basics. Here are some topics to discuss with your medical team. So be your age, your point in life, including your family life and work situation, your overall health, your expectations for treatment, your available resources and support system, logistics, including transportation needs, costs, and any additional questions. The decisions that you and your medical team make about your treatment should reflect both your medical condition, your personal relationships, situation, and goals. This is an empowerment approach to set your goals to plan a strategy for each goal, to find resources, ask for help, don't do it alone, and to take action. Shared decision making. Treatment decision making equals shared decision making. Shared decision making is relationship based. So it's you and your healthcare team discussing the available treatments that align with your values, goals, and current living situation. Shared decision making is an ongoing process. Your values and goals can change over time, and your available treatments may change too, depending on your cancer. Write your treatment plan with your doctor. This is a collaborative process. You might have different healthcare professionals that are part of the treatment decision process, but it's important that your goals and values are central to this plan. Setting your goals. Here are some different areas. Your physical, emotional, and sexual health and well-being. And a question to think about: what is the most important for you to be able to do? And then for family and social relationships, what's going on in the lives of others that's important to you? For work, school, or home, do you want or need to continue working? Can you adjust your schedule, responsibilities, or career goals? Are you getting the help you need for tasks at home? Community and involvement. Are you getting support you need from your community? Are you able to stay involved in your community? Personal and spiritual growth. Are you taking care of yourself spiritually and emotionally? And then other, what else is important to you? You probably have things that you could add to these lists and these questions. It's a lot to think about. So when you talk to your doctor about your treatment options, ask about the goals of the treatment and how each treatment might affect the goals that you have for your life. If you choose not to receive treatment, think about your goals for the care that you receive. Possible goals may be to live as long and or as well as possible, or make it to a special event or milestone. Let your healthcare team know about your treatment and your personal goals. That's really important. Another thing that's really important is to understand your values. It's important that you think about your values and what matters to you. Values may be, I value being active with my family. I value being healthy to attend, and you can fill in the blank there. I value having few side effects. I value having the best treatment available no matter what. I value being a part of a clinical trial to help advance science. Your values are important for goal setting. Your goals and values can change over time. Ideally, your treatment would have 0 side effects, 100% guaranteed cure, and no cost, right? But unfortunately, you might have to choose what matters most to you among these options. It does depend on your cancer and its stage and treatments available, but it is important to think about what matters most to you during this time. So here are some helpful tips. The cancer journey has many decision points along the way, and here are some helpful tips to remember. Break the process into smaller bites. just one step at a time. Locate yourself in the process. Think about your goals, your life, and your current situation. Work with your doctor to create a written treatment plan. Having your treatment plan written will help you see it more objectively and give more opportunity to reflect and evaluate. Understanding your diagnosis. Here are some helpful tips to fully understand your diagnosis. Ask your doctor to tell you exactly what kind of cancer you have and to write it down for you. If you don't fully understand, don't hesitate to ask questions. Ask for a copy of your lab report. Ask your doctor what they base their treatment recommendations on, and talk with your nurses. They can help answer questions. Talk to other people who have had cancer, especially those with a similar diagnosis. Knowing the exact type and stage of your cancer will help you find useful information and to make treatment decisions. Each person that you talk with will have different knowledge and experience that will help you see your cancer from different viewpoints. And then understanding your diagnosis. Here's some questions that you can ask about your cancer diagnosis. Like, what type of cancer do I have? What stage is my cancer? And what does that mean? What symptoms of cancer might I experience? What types of tests will I need? And where can I get a second opinion? So our next speaker is Doris Van Meurs, and she will be presenting the next section of slides.
Okay, thank you, Sandy. We'll continue with talking about our healthcare team. Your choice of a doctor and cancer center will depend on these factors: your cancer type and stage, your personal preference, your insurance coverage, and logistics such as transportation, distance, and cost. It is critical to feel comfortable and confident in the people responsible for your treatment. You can always seek a second opinion or change doctors if your situation changes and you need a different level of care. Possible members of your healthcare team may include a medical oncologist, nurses, surgeon, surgical oncologist, pathologist, radiologist, radiation oncologist, dosimetrist, radiation therapist, medical physicist, general practitioner, social worker, and also the possibility of a pharmacist, psychiatrist, psychologist, registered dietitian, plastic surgeon, rehabilitation specialist, home health aide, hospice care providers, and clergy. There's a lot of people that may be involved on your team, and their sole goal is to help you get the treatment and support that you need along the way. As you prepare for your doctor visit, I know Sandy referenced this earlier about preparing for the visit by writing questions down before you go to the doctor. Bring them to your appointment and use them to talk to your healthcare team. And then write down the answers to these questions. And don't record the visit without first asking and discussing it with your doctor. It's helpful to bring a friend or a family member with you to take notes and to tell your doctor and nurse about all the medications you are using, including over-the-counter medications, vitamins, or supplements. Do this for every doctor appointment. New information can be shared, and new treatment decisions might have to be made each time. It's good to have everything in one place to keep track. Although recording a visit could be helpful for you to help remember the key points, it's important to talk about this with your doctor. Just like you trust your doctor trusts you. And there are also HIPAA regulations that exist to ensure that your privacy is protected. So it's important to discuss how to keep these recordings safe with your doctor if you plan on recording. What you can do. Try to stay focused on what is happening right now, rather than trying to make all the decisions at once. Ask to sit down with a financial or insurance counselor at your cancer center. They can help you understand what the costs may be and a plan to pay for it, or to find resources to assist in payments. Take advantage of available resources and understand that things and how you feel about them will change over time. Now we will talk a little bit about treatment options. Factors to consider and discuss with your doctor are: what are the goals of the treatment? What are the potential benefits? What are the types and severity of side effects? What are the reasons behind cancer or treatment choice? And what are the costs? Cancer research and treatments are constantly changing. While this progress can be helpful, it can also make the decision-making process a little bit more complex. I'm going to talk a little bit about guidelines versus pathways. There is a focus on developing evidence-based standards of cancer care, and this helps both doctors and patients make informed treatment decisions. The two basic approaches to developing these standards are called guidelines and pathways. It is important for people facing cancer to know that guidelines and pathways exist, as they may have an impact on treatment recommendations. Guidelines are more of a resource for doctors and patients. Pathways are formulas used for making and paying for treatment. We'll talk a little bit more about guidelines. Guidelines are based on specific subtype, genomic profile, and stage of your cancer. Panels consisting of cancer specialists and experts in psychosocial care and patients help make these guidelines. Guidelines are developed based on what is known to work best for treatment. The cost of treatment does not typically impact guidelines. Guidelines are treatment recommendations that use the best available data to guide treatment decisions. Pathways. Pathways are shown to improve quality of care by ensuring that patients receive the most proven therapies rather than unproven and expensive ones. Pathways include preferred drug choices. In some cases, oncologists receive financial incentives for adhering to these pathways. Pathways also provide treatment recommendation for specific cancers and are developed by expert panels. They can be influenced by the cost of using a drug or treatment. They are created by insurance companies, for-profit companies, and oncology practices, reflecting an optimal standard of care. Questions to ask about treatment options. What is the goal of this treatment? Why are you recommending this treatment? What are the benefits and risks of each treatment? How can we prepare for and manage the potential side effects? How often will treatment be given and where? How is the treatment given? Is it through an IV infusion or taken a pill by mouth? How long does each treatment last? Does the facility where treatment will be given also offer resources for emotional support? Let's talk a little bit about treatment options. Chemotherapy, radiation therapy, also called radiotherapy, surgery, targeted therapy, and immunotherapy. Chemotherapy. Chemotherapy is a treatment that involves the use of drugs to destroy cancer cells. Chemotherapy can be given through an IV, a pill, an injection, or applied directly to the tumor. Chemotherapy is called a systemic therapy. Chemotherapy drug combinations will vary in dose and frequency depending on your type and stage of cancer. Radiation therapy or radiotherapy. External radiation is delivered by a machine aiming high energy rays at a specific body area. Treatments are usually once a day for several weeks. Internal radiation, at the radiation source such as seeds, ribbons, capsules, or liquid is placed inside the body. Inpatient treatment may occur until the body no longer gives off radiation at a high level. Radiation is the use of high energy rays to kill or damage cancer cells. Surgery. Surgery is the most common form of cancer treatment. It may be used alone or in combination with other treatments. Surgery may be used in diagnosis to determine what cancer you may have. Surgery may be used to stage to determine how your cancer has developed. Surgery may be used in treatment to try to stop the spread of cancer cells. Surgery may be used for debulking, reduction of tumor that cannot be fully removed. And it may be used for reconstruction to restore function or appearance of a body part that's been affected by cancer treatment. Targeted therapy. Targeted therapy more precisely attacks cancer cells by targeting specific genes or proteins. Targeted therapy can be given through an IV, a pill, or an injection. Not all cancer types can be treated with targeted therapy. And targeted therapy also does not necessarily mean that it works better than the other treatments or that it has fewer side effects, but it is an option as a treatment. Immunotherapy. Immunotherapy works with your immune system. It uses the body's natural defenses to identify, attack, and kill cancer cells. Immunotherapies are usually given using an IV and may be used along with other treatment options, such as chemotherapy. Palliative care and supportive care. Palliative care focuses on providing patients with relief from symptoms, pain, and stress of a cancer diagnosis. Palliative care can start at the time of your diagnosis. The goal is to improve your quality of life for the patient and also to attend to the needs of the family and caregivers. Palliative care is not the same as hospice care. Palliative care is provided by a team of healthcare professionals who work together with the patient's other doctors to provide an extra layer of support. Some questions to ask during your time of treatment. It's helpful to notice what the symptoms and side effects are and how they are affecting you and how they are interfering in your life, and maybe name the ways that they interfere with your life. And then to ask the question of your doctor, What can we do to manage these symptoms? Could complementary therapies or supportive palliative care help manage my symptoms and side effects? Will you refer me to a palliative care specialist? You may have side effects from your treatment, and it's important and helpful to track what your side effects are, to maybe write them down on a piece of paper at the time that they're happening. How severe are they? What are you feeling? How do they impact your life at that moment? And make sure that you talk with your doctor about these side effects. It's helpful to use a scale of 1 to 10 to rate the severity of these side effects. Be as specific as possible when describing the side effects to your doctor. This will help to provide you the most accurate relief. And our next speaker is Lindsay Jousma, who will present the final selection of slides and information.
Thank you so much, Doris. Hello, everyone. It's a pleasure to be with you all today, and thank you to Sandy and Doris for starting this important dialogue around treatment decisions and empowering us to know what those options are. Wanted to take a deeper dive with us here today, talking about some of these important documents. These are important documents for everyone. We have a great resource through Michigan called Making Choices Michigan, which is makingchoicesmichigan.org. And that's a great local resource for us. Some of these terms, if you will, that we will cover today: a living will or an advance directive. This lets your doctor know what kind of medical care you want if you cannot speak for yourself. A durable power of attorney. This is where you name a person who will help make health decisions for you if you're unable to make them for yourself. This person is called a healthcare proxy, and this person does not need to be an attorney. A few other terms to cover today as important tools for us. A financial power of attorney. This is where we get to name a person who will make financial decisions for your home, your medical care, in the event that you are unable to do so for yourself. A DNR, a do not resuscitate, or AND, allow natural death. DNAR, do not attempt resuscitation. Order. It's an order for your doctor if you would not like heroic measures to be taken in the event of cardiac or respiratory arrest. And finally, a will. A will states who will receive your money and belongings and who will be responsible for your children in the absence of another parent. It is best if these documents are completed, talked about prior to any emergency situation or advanced disease. Many people have these documents completed early on, even if they're never needed. These are really great resources within the hospital. There's people who will come to speak to the patient about what each document is, what it means, and help complete these documents. Now we'd like to talk a little bit about caregiving, this important role, and just to name a few things that we might experience when caregiving. For example, while you may feel rushed to make a decision about your loved one's treatment, it is important to remember to slow down and think things through. So even in the midst of feeling rushed, to remember that it's okay to slow down and think things through. This will give you a greater sense of control and provide a calm presence. Take the time to ask questions, think through the steps, and partner with the medical team to develop a treatment plan for your loved one. It's helpful to also talk with the person before the before making any important decisions about their care. This is why sooner rather than later is better. And just to please know that things may have changed and things may change as you navigate this journey together. Just to keep talking with one another, keep those lines of communication open. This is a theme today that we're noticing, the importance of taking notes for ourselves and for our loved ones. And then after your appointment, compare your notes and discuss what each other heard. You might interpret things differently or may have missed something. Also, naming the importance here to take care of yourself. Make some time to take care of yourself and ask for help when you need it. Dealing with cancer diagnosis is hard on everyone, and you might be overwhelmed, scared, upset, and feeling many emotions. Very normal to experience these emotions, and you're allowed to feel these emotions. So taking the next steps. Being selective as to where you find your information. Be sure to use proven, reliable sources. Benefit from the experiences of others, and remembering that your path is unique. Choose a doctor that you can trust and feel comfortable openly talking with. One of the wonderful resources that we all have at our fingertips is Cancer Support Community. And as Gilda's Club Grand Rapids, we are an affiliate of Cancer Support Community. And we'd like to take a moment to go through some of these resources that are available to you and to our community on a cancer journey. The first one here, Cancer Support Helpline. As you can see listed right there, the number 888-793-9355. This is staffed by licensed professional counselors, which are available to you Monday through Friday from 9 to 9. The Cancer Experience Registry. It's a community of people impacted by cancer, focusing on collecting, analyzing, and sharing information about the experience and the needs of patients and their families throughout the cancer experience. There's Open to Options. This is a research-proven program that can help you prepare a list of questions to share with your doctor. Specialists can help you create a written list of specific questions of your concerns to share with your doctor. And then finally, Frankly Speaking. We're getting a taste of that today at our very own Frankly Speaking here at Gilda's Club Grand Rapids. And that is because of the support of the Cancer Support Community. Frankly Speaking About Cancer is the Cancer Support Community's landmark educational series, providing us with trusted information on a variety of topics which are important to people impacted by cancer and available on a plethora of platforms. So to take a deeper dive to look a little bit further into this Cancer Experience Registry, what is it? Well, it's a research survey to identify and understand the emotional and social needs unique to the cancer experience. This Cancer Experience Registry helps to inform medical professionals about patient needs, which can then improve quality of care. And it is confidential and secure. This next graph here shows us a little bit of the Cancer Experience Registry timeline. So as you can see over the course of the years, there have been many diagnoses that have been apart. If you'd like to join the Cancer Experience Registry, there's 3 easy steps, and you simply go to www.cancerexperienceregistry.org. Follow the 3 steps and fill out your survey to share your experience through a personalized page And then you're also provided educational resources and news surveys. The cancer support community invites you to join our grassroots movement. This is to be an advocate for people impacted by cancer. A lot of great work happening through this platform to help ensure that people impacted by cancer have access to quality, comprehensive cancer care, and that includes social and emotional support, which we know is so important. This community will provide the opportunity to get up-to-date information on key issues, which are important to patients with cancer and their loved ones, be a part of the network that interacts with Capitol Hill and other policymakers on important issues to cancer patients, to have your voice heard alongside other voices of patients with cancer and their loved ones. There's the website to join right at the bottom of the slide there. Finally, another great resource provided through the cancer support community is My Lifeline. And you can reach this at www.mylifeline.org. This is where patients and caregivers have the chance to create and set up interactive blogs, updates, of a platform to let your family and friends know how you're doing, and they'll email them when you post an update. There's many features like a helping calendar to coordinate volunteers to help with meals, rides to treatment, errands, childcare, pet care, and more. Discussion boards where people can connect with one another on an online forum, patients and caregivers, to provide opinions, stories, information, and inspiration. Care coordinators to help assign family members and friends as your care coordinators to help manage your site and organize volunteers. And then, of course, privacy controls. Your cancer experience is personal, and this allows you to ensure that the right people have the access to comment on your site and to volunteer. So some wonderful ways that cancer support community resources are available to all of us. And we want to thank you so much for joining us today. We're so glad that you did. Before we get into questions and answers and a little bit more dialogue, we just wanted to share our appreciation for your tuning in to our program today to learn more about making treatment decisions, which we know is a very important topic and a part of the cancer experience and the cancer journey for patients and for caregivers and the whole family. We welcome you to Gilda's Club Grand Rapids. We are an interactive, free social emotional support program, and currently we offer all of our program on the virtual platform. And we would be more than happy to connect with you and help plug you into the community here at Gilda's Club Grand Rapids. You're more than welcome to give our program team a call. We are here answering the phones, and our phone number is 616-453-8300. You can also reach us on our website at gildasclubgr.org. We would be glad to connect with you further, help connect you with the community here at Gilda's Club Grand Rapids. So thank you so very much for joining us today.